Moving to Switzerland, or already here and feeling lost in the world of healthcare paperwork, you have probably heard or you already know that health insurance isn't optional, it's mandatory. But understanding how it works, what it covers, and how to choose can feel like climbing a mountain. In this video, I'm cutting through the complexity to give you a simple, clear guide to Swiss health insurance. I will explain why everyone needs it, the different type, how costs work. Understanding the Swiss health insurance system is a vital step for anyone living or planning to live in the country. To start, let's understand the fundamental reason behind it. Why does everyone in Switzerland need health insurance? Imagine a system where everyone in your town or city puts in a little bit of money each month. This money isn't just for themselves, but it's like a shared pool that helps anyone who gets sick or has an accident. That's kind of how health insurance works in Switzerland, but on a bigger scale. It's for everyone living in the country. It's not just a good idea, it's actually the law. If you plan to live in Switzerland for more than 3 months, you absolutely need to get a health insurance. This is the rule that has been in place for decades to make sure everyone has access to medical care. If you are new to Switzerland, you have 3 months to get it sorted, and your coverage will even start from the day you arrive. Even babies need their own health insurance shortly after they are born. If you don't get health insurance on time, you might find yourself automatically signed up and possibly having to pay extra. Think of it a bit like car insurance. You might be a super careful driver, but you still need insurance in case something unexpected happens. Health insurance is similar. You might be feeling great now, but it's there to help if you suddenly get sick or injured. This system is built on an idea called social solidarity. It basically means that everyone in the community works together to make sure that everyone else gets the health care they need, regardless of how much money they have or how healthy they are. So even if you are fit like a soccer player, your contributions help someone who might be going through a tough time with their health. It's like a big community helping hand where everyone looks out for each other. Because of this system, Switzerland has a really good healthcare system, often ranked among the best in the world. This mandatory insurance plays a big part in keeping the quality high and making it accessible to most people. Switzerland invests a significant amount of money in its healthcare system, showing how important it is to the country. While the system isn't run directly by the government, there are rules and regulations in place to make sure it operates fairly. The responsibility for healthcare is shared among different levels of government, with the canton having a big role in managing the healthcare services and the national government setting the overall policies. Now that we know why it's mandatory, let's look at the different types of insurance you will encounter. When you are navigating the world of health insurance in Switzerland, you will quickly learn that there are 2 main categories: basic insurance and supplementary insurance. Think of basic insurance like the essential coverage, the one that everyone living in Switzerland for more than 3 months is legally required to have. It's like the foundation of your health protection, covering a standard set of important medical services. This includes things like going to the doctor when you are sick, visits to the hospital if you need them, getting the medications your doctor prescribes, and care related to pregnancy. The government sets the rule for what basic insurance must cover. So no matter which insurance company you choose for your basic insurance, the list of covered services will be quite similar across the country. This is all laid out in the Health Insurance Act. It's designed to ensure everyone has access to essential healthcare. Around 60 to 50 authorized health insurers offer this basic coverage, and they all have to provide the same benefits without any exceptions. Importantly, this company can't refuse to enroll you, no matter your age or how healthy you are. On the other hand, supplementary insurance is like extra coverage you can choose to get on top of your basic plan. It's not a must-have, but many people in Switzerland, over 80%, opt for it. This additional insurance covers things that the basic insurance doesn't, or it can give you more comfort and options when you receive healthcare. For instance, basic insurance usually doesn't include routine dental care, but a supplementary insurance often does. It can also cover things like getting a private or semi-private room if you need to stay in the hospital, or it might help with the cost of alternative treatment like massage or certain therapies. You can even get coverage for things like glasses and contact lenses for adults, treatments you might get when traveling abroad, and even contributions toward gym memberships. There are generally two main types of supplementary insurance: for outpatient care and for hospital stays. Unlike basic insurance, the companies that offer supplementary insurance have more freedom in deciding what they cover and how much it costs. So these plans can vary quite a bit. Also, these companies can sometimes refuse your application or exclude coverage for health issue you already have, which isn't allowed with basic insurance. You will usually need to fill out a health questionnaire when you apply for supplementary insurance. So you have got your basic insurance sorted and maybe some supplementary too. But how does it actually cost? And what are those terms like deductible and copayment? Understanding how much Swiss health insurance costs involves looking at a few key components, kind of like understanding the different charges on a phone bill. The main costs you will encounter are premiums, deductibles, and copayments, sometimes referred to as retention fees. Premiums are like your monthly subscription fee for having health insurance. This is the amount you pay to the insurance company every month to keep your coverage active. According to the Federal Office of Public Health, the average monthly premium in 2025 is around 378 francs, but this can change quite a bit depending on different factors. Several things can influence the price of your premium, such as where you live, how old you are, and the specific type of basic insurance plan you choose. For instance, premiums tend to be higher in cities like Geneva or Basel and lower in more rural areas like Appenzell Innerrhoden or Uri. Your age also plays a role, with a premium generally increasing as you get older. Remember that premiums are usually per person, not per family. There are also different types of basic insurance plans, which we will discuss later, that can affect how much you pay each month. Next up is the deductible. This is a specific amount of money you have to pay yourself each year before your insurance starts covering most of your medical expenses. When you sign up for your insurance, you get to choose how high or how low you want your deductible to be. For adults, the options range from a lower amount like 300, which is the minimum, all the way up to a higher amount like 2,500, which is the maximum. If you choose a higher deductible, your monthly premium will actually be lower, but you will have to pay more out of your own pocket if you need medical care. For children under 18, the standard deductible is 0, meaning parents don't have to pay anything before the insurance starts covering costs. However, they can choose a higher deductible for their children as well to potentially lower their premiums. For adults, many people find that choosing either the lowest deductible or the highest makes the most financial sense. Finally, there is the copayment, also known as retention fee. This is a small percentage of the cost that you still have to pay for some medical services, even after you have reached your deductible for the year. In Switzerland, the standard copayment is 10% of the cost of your treatment. However, there is a limit to how much you will have to pay in copayment each year. It's 700 for adults and 350 for children. Once you hit this limit, your insurance will cover the rest of the cost for the year. There is also a daily contribution of 15 francs that adults have to pay if they stay in the hospital, although children and young adults who are still in education are usually exempt from this. Here is a simple example. Imagine you choose a deductible of 500. If you visit a doctor and the bill is 300, you have to pay the full amount yourself. If you need to go again and the bill is 400, you will pay the remaining 200 of your deductible. Now you have paid your 500 deductible for the year. If you need more medical care that year, you will typically only pay 10% of the cost, up to the annual limit of 700, and your insurance will cover the over 90%. Choosing the right deductible is a bit of a balancing act. If you pick a higher deductible, your monthly premium will likely be lower, which can save you money if you don't need much care. However, if you end up needing significant treatment, you will have to pay more out of your own pocket before your insurance kicks in. So now you have a good understanding of the basics of Swiss health insurance, why it's required, the difference between basic and extra coverage, and how the costs like premiums, deductibles, and co-payments work. In the next video, we will dive into the different types of basic insurance plans you can choose and how you might be able to save money on your health insurance. Make sure to subscribe so you don't miss it, and please share this video with someone who might need it. Thanks for watching, and I will see you in the next part.